progress on vaccinations for COVID-19 has led to new gains for economic recovery, but a failure to meet vaccination goals, along with the spread of new variants, has raised concerns about the limits for reopening, especially when it comes to rules for worker health and safety. That was the issue recently before the state's Department of Labor Standards. To tell us about the testimony from worker advocates at MassCOSH is its executive director, Jodi Sugerman-Brozan. Thank you very much for being with us, Jodi.
Thanks for having me today.
Jodi, before we get into the details of regulation in Massachusetts, what do you see as the bigger context? Because I see these news reports about people in Washington, they're debating about, where to require mask wearing. So, what does that mean about here?
Yeah, I think that our perspective here at MassCOSH is from the worker health and safety protections. And one of the things that has been a real failure of our state has been to recognize the role that workplace exposure is playing in making people sick and die and spreading the virus. We've been pushing on this for some time. We worked really hard to get worker protections in place. We worked really hard to pass a law that required tracking the occupation of COVID patients. Unfortunately, the state just never collected that data despite the law. And it's really been a failure. I think the state just has never made those connections. And it's been at the peril of workers and their families. And we're really concerned as the new variants take hold that the state is now planning to completely repeal the protections we worked so hard to put in place.
Well, let me ask you about one cluster in Massachusetts, and this is at Provincetown, mainly around the 4th of July weekend. At first, we think of that as the opposite of a workplace. We think of that as a holiday weekend down the Cape, but isn't that maybe about workplace spread too?
Always, and I think this is a really critical piece. Folks who are there enjoying their vacations, they can make decisions about what kind of exposure they're willing to risk. Those working in the restaurants and the stores and retail facilities, they don't have a choice. They are workers there. They are risking their exposure every day in order to make a paycheck and feed their families. So that is a really critical piece. And those workers, even if they're vaccinated, we now know that vaccination status doesn't prevent you from spreading the virus. It means that they could be bringing it home to their unvaccinated children, which is something that a lot of people are very concerned about. I want to say we very much support vaccines. Vaccines are the best way to ensure your health and safety. Those who are vaccinated have better outcomes, fewer symptoms, but they are not the only way to protect workers, and there has to be layers of protection to ensure that they can stay safe and ensure that their families are safe.
Well, I know right now the question in Massachusetts is whether to continue the state requirements for the emergency period. Now, people riding the T, they know they're supposed to wear a mask if you're inside a vehicle of some kind. But on the other hand, some other people might be thinking, well, is the state really regulating this kind of emergency situation anymore? What's the story?
Yeah, well, the reality is that for these workplace regulations and even the other regulations, so masking is still required on public transportation. That is supposed to be being enforced by the Mass Department of Public Health, but we're not really quite sure how that's happening. And it's largely being left up to folks to be able to decide for themselves. You're supposed to wear a mask if you're unvaccinated, but we're relying on people through the honor system. And as a worker who might work in the MBTA system, driving a bus or otherwise, I'm not super excited by the idea that I have to rely on people through the honor system in order to ensure my own health and safety. And I'm not sure what enforcement is happening with regards to those few remaining protections that are in place, and that is masking in a few different places around Massachusetts. One of the things we do know is that when these protections for workers were in place, they were doing their job to a certain degree. The Department of Labor Standards received 1,600 complaints in the time that those regulations were in place. About more than half, 53%, resulted in violations that led to improvements that made workers safer. And I should say, those are just the ones enforced by the state. Those regulations were enforced by both the Department of Labor Standards and our local public health departments as well. And they received, thousands of complaints that they addressed as well. It was just a way for workers to ensure their rights and a way for them to be able to step up and get some support if they felt that their workplace was not safe. And it also protected them from retaliation should their employer retaliate against them for discussing or bringing up unsafe conditions.
I want to ask you about things that could go wrong in workplaces. And I'm going to start with big name employers. It could be the US Postal Service or UPS or maybe Amazon warehouses. What have we learned about what has happened there as far as protecting workers or even just giving them notifications?
Yeah, I mean, I think this is a really critical question because one of our messages to the Department of Labor Standards is that we need to update and not repeal the regulations because we've learned a lot over the last 15 months. And the most important thing that we've realized over the last 15 months is that the way this virus is spread is through aerosol and through breathing in particles, much less so through fomites from touching. And that means that the most important thing we can do to protect workers is ensuring good ventilation, infiltration, and masking and distancing. Those are the critical pieces. And I think big facilities really need to ensure that they're providing that and that they're providing distance space so that people can keep their distance, that 6-foot distancing, and masking, especially in major retail facilities where the exposure is going to be very high. And especially, we know vaccination rates in Massachusetts are 62%, sort of stalled out there at the moment. But we know that certain communities have much lower vaccination rates. And if you work in one of those communities, your viral load, if you work in a retail facility, is going to be higher. You're going to be exposed to more people who are unvaccinated. So ventilation and filtration is really critical. And actually, that was not part of the regulations. We need to update those state regulations to ensure that kind of protection, and masking and distancing. Those are really the critical pieces.
I want to ask you about the other end of the economic spectrum here as far as businesses, the small neighborhood businesses. It could be a restaurant or a boutique of some kind. They don't have the money of Amazon.com or UPS. What about their ability to protect workers?
Yeah, it's a simpler when you're in a smaller space, opening windows, fans, HEPA filters in your facility that are a couple $100. There are definitely ways to do that. And I have to tell you, in my experience, these small businesses want guidelines. They want to know what is expected of them to protect their workers. Leaving it up to them is not working. And in my neighborhood here in Boston, I can walk down the street and every other business has masks required here, not required, masks only required if you're unvaccinated. It's very confusing, and state guidelines help them understand what they need to put in place to ensure the health and safety of their workers and, prevent spread of the virus.
What about schools? Here in Boston, at least in the Boston public schools, we have a student body that's mainly from neighborhoods that are underserved for vaccinations, and not all the kids are going to be even able to get their shots. What about keeping that environment safe? Yeah,
I think we're seeing a definitely increasing consensus around the pediatric and medical community that masking for children when we go back to school is going to be critical. We're seeing more and more from that. And I think more and more of the medical community pushing the CDC to rethink their guidelines around that. I'm a Boston public school parent. I know that in our buildings, there's 135 Boston public school buildings, only 35 of which have HVAC in the first place. So where there is HVAC, they may have done upgrades with the right kind of filtration, but those buildings are not set up to provide the appropriate kind of ventilation and filtration that's needed. And so to protect our students and our teachers, I think we are going to have to continue pushing forward with masking, distancing, and ensuring that the health and safety of our students and our teachers are at the forefront of what we do when we look to go back to school.
One category of workers you seem to be especially concerned about are the people in public sector healthcare facilities. Why are you so concerned about them?
Yeah, well, for what folks may know, that the Occupational Safety and Health Administration was pretty much missing in action throughout the Trump administration. And when the Biden administration came in, advocates really pushed very hard and said, we need we need OSHA to step up. We need emergency standard here so that workers are protected. Back in June, they issued an emergency temporary standard. That standard, unfortunately, is not for all workers, but it is for workers in healthcare facilities. Because here in Massachusetts, we have a public sector OSHA law, that law requires that our state provide the same level of protections to our public sector workers that our private sector workers are receiving. And that means emergency temporary standards go into effect here in Massachusetts as well. The Department of Labor Standards is saying that they do not and will not enforce that emergency temporary standard for workers in public sector healthcare facilities. And we think that's illegal. We also think it's foolhardy, especially given the really abysmal record that the state had in state-run facilities, like state-run nursing homes. These protections are critical. OSHA has put them out for workers in healthcare facilities and workers here in our public sector healthcare facilities to serve the same protections, and they should be getting them through our public sector OSHA law.
Currently, at least a broad stroke guidance from the CDC is that people who've been fully vaccinated don't have to wear masks. But if you look at that cluster of cases from the Cape, I understand that a lot of the people who got infected have already been fully vaccinated. So what does that mean for a policy on masks?
Yeah, I mean, I think for me, what that means is that we cannot let our guard down. And now is not the time to let our guard down, especially as things like variants like the Delta variant and a couple more headed our way. Masking is one of the surest ways to ensure that people stay safe. The medical community is not concerned by what they call the breakthrough cases. This is pretty typical. And in fact, most of the folks who get these breakthrough cases have less symptoms. But it is important to point out that 80 people, fully vaccinated people in Massachusetts, have died from COVID-19. So that is enough. And to save any life is important. And wearing masks is one of the real ways that we can ensure that we are protecting folks. And again, I think one of the things that we are and we know workers are concerned about is it is clear that we can spread the virus, especially the Delta variant, even if we're vaccinated. And many of us have children at home who are not vaccinated. So bringing that home to our families. We also know that children are mostly exposed to the virus in the home, which means that it's coming in with their family members through workplace exposure and otherwise.
Finally, I know there was a deadline this afternoon, if I'm not mistaken, about getting comments in about these regulations in Massachusetts. But other than that, how can people influence what happens next?
Yeah, I think it's really important that people step up and demand that workplace protections are updated, not repealed. The comment deadline was 4 p.m., but I still encourage people to write to the Department of Labor Standards. The email is dls.feedback@state.ma.gov. Let them know that workers need protections. They need protections to stay safe, to keep their families safe, and to prevent the spread of COVID-19 here in Massachusetts. They need to hear from us. They know that they said they'd be making their decision as early as Friday. So I really encourage folks to make their voices heard. It's a really important issue.